Hi, I'm going to do my physical assessment. So what I'm going to do first is I'm going to gather my supplies, everything I need, and then I'm going to enter my patient's room. And what I'm going to do first is I'm just going to introduce myself to the patient, provide privacy. I'm going to ask the patient to state his name and date of birth. And then I'm also going to ask him to say the date today, just so I can get a feel for if he's alert and oriented. And he is, so I'm just going to explain to him what I'm doing when I do it. I'm going to do my physical assessment on you today, and what I'm going to do first is I'm just going to work from the head down. So what I'm going to do is before I would enter the room though, we would take his height and weight, and I would take his temperature and his O2 sats on his finger, with the machines provided, and then I'm going to ask him if he has any pain, and if he does, I'm going to ask him if there's any aggravating or relieving factors, when it happens, or if it's all the time, the severity from 1 to 10, 10 being the most. Also, I would ask him if he takes anything for it. So next I'm going to assess his mouth and see if he has any loose teeth, any missing teeth, how his gums and his tongue look, if there's any discoloration, if his lips are dry or cracked. Then I'm going to look at his nose to make sure there's no redness or swelling. Then I'm going to take a look at his eyes and make sure that there is no abnormal color in the drainage of his eyes, anything other than tears. I'm then going to do the 6 cardinal signs of the gaze, the field gaze, and I'm going to go laterally on both sides, and then up to the right, down to the right, up to the left, down to the left, to make sure his pupils move at the same time, and also that they're both reactive. And then I'm going to just go and make sure that they're equal and reactive to light, and how big they are. You can gauge that on this pupil gauge. Then what I'm going to do is work my way down the body, and so I'm going to listen to his heart and lungs, and anterior lung sounds at this time, since my patient is laying down. And I'm going to listen to the aortic, the pulmonic, the tricuspid, and the mitral. Then I'm going to listen to all 5 lung sounds on the front, listening for any wheezing, rhonchi, crackles, anything out of the ordinary. So 1, 2, 3, 4, and 5. Then what I'm going to do is I'm going to take his pulse and respirations, taking them each for 30 seconds, and then timesing both by 2, not letting the patient know that I'm taking his respirations. And after that 30 seconds, times it by 2, and then I'm going to test for capillary refill. Anything less than 3 seconds is a good capillary refill, and that would make it a negative Hohmann sign. And then I'm going to test his musculoskeletal, and I'm going to have him grasp both my hands to look for equal grasps and strength. And they're equal. And then I'm going to do the same for the feet. I'm going to have him push against my feet, keeping him covered here. And the whole time I'm doing this, I'm assessing the skin to make sure that there's no bruising or bed sores or anything out of the ordinary, no vein distension. And I'm going to have him push against my feet or my hands, and the same the other way. And then I'm going to assess his pedal pulse, and that's good. And then next I'm going to assess his bowel sounds. I'm going to ask him when the last time he had a bowel movement was, and then I'll listen to these next in all 4 quadrants. Make sure that all bowel sounds are active in all 4. And they're active in all 4. And then I'm going to palpate to make sure there's no tenderness, distension, and that's good. And I'm going to ask him if he about his voiding, if he has any frequency or pain with urination. And then I'm gonna have him smile, because I need to make sure that both sides of his face are equal and symmetric, and I want to look for any drooping or anything like that. And then I'm going to have him sit up, and I'm going to listen to the posterior lung sounds. I'm going to help him here, and then I'm going to listen to all 9 lung sounds in the back, listening for the same things I did on the front: the wheezing, the rhonchi, the crackles. Alright, I'm going to set him back down. What I'm going to do next is I'm basically done with my physical assessment. I'm just going to kind of ask him if he wants any excess information on patient learning information, anything that he has had in his family history that he would like information on. I would make sure he's comfortable. I would lower his bed, give him his call light, and then I would go and document all my findings.